The Modern Civic University is a key element of the health and well-being of a modern city. Liverpool John Moores University is at the forefront of that movement. And right in the heart of that are the Public Health Institute. At the Public Health Institute, we pride ourselves on our applied research, our education programmes and our engagement and impact.
Public Health Institute has been established here in John Moores University since the late 90s, and we focus a lot of our research on some of the major issues which affect society today. So that includes drugs, alcohol and smoking. We work with national government, but we also work with a number of international agencies such as the European Union and the World Health Organization. We aim to understand what these issues are, what these problems are, and how to develop effective policy and practice.
Our main aim is really to help communities, both locally and internationally, overcome many of the key global public health challenges that they're facing. We also have a whole raft of European partners in the United States. We're part of a WHO collaborating centre for violence prevention.
An important international initiative we've been involved in is the development of the V-Info toolkit. This is working with low and middle income countries to help them to try and reduce violence.
We work closely with the Ministry of Health and Education in Nepal, and as a part of the research we trained about 80 nurses in Nepal on how to identify the mental health problem in early stage, how to support them. And the mental health is not something, it's a priority in many countries.
And for the last few years we've worked with the National Institute for Health and Care Excellence, NICE, to help them develop guidelines for policy and practice. For example, looking at drug prevention, alcohol education, but also around needle exchange for steroid users.
We use intelligence to feed back information to local authorities on areas of interest to them, such as looking at people using low threshold drug and alcohol services such as syringe exchange. We found that although the national narrative is the numbers that are using drugs who are presenting to treatment are going down, from our own data, people who may not be presenting to treatments, we found that actually those numbers are increasing, and so it provides extra intelligence to the national picture that local authorities otherwise wouldn't have.
Well, probably our key partnerships are with the communities that we engage with.
We engage with the community so that we can understand what kind of research we need to do to make a difference. And the overarching important quality that the work focuses on is around tackling health inequalities. Things like poverty, unemployment, disability all have an impact on health outcomes.
For example, here in Merseyside, we've been working with local commissioners to try and understand how community groups and some of the very simple actions that they're doing can increase health and well-being, decreasing feelings of loneliness, for example, improving people's opportunities for recovery from drug and alcohol abuse. And I think it's really that sort of community level work that we're most proud of and we think makes the most impact.
We have a research contract with the Directors of Public Health across Cheshire and Merseyside. Some research has looked at the health and well-being of young people and children across Cheshire and Merseyside. That has been used to inform policy and practice.
Here in Liverpool, we've been involved in the Drink Less, Enjoy More programme, which is about training local retailers of alcohol and bars around the rules about serving to drunks. And our evaluation of that programme showed that this initiative actually reduced selling of alcohol to drunk patrons, which could have real public health impact.
What we do here, and with the engagement side of the work, is we go out and we meet with people in the communities who are maybe more vulnerable or who are more disadvantaged or hard to reach, and we find out about their experiences and then we give them a voice.
Knowing that our research actually makes a difference to local communities and can potentially change policy and practice for the better is something that we're all very proud of, and I think probably what motivates us most in our research.
And also produce really high quality education for our students and linking our research really closely with our education and scholarly activities.
We have a large cohort of international students, and what we find is that relationship and that interaction between international students and our local students is where real benefits can be gained.
They are doing excellent international research. Some of the students are looking for the experience of disabled people in earthquake in Nepal. Other student is looking at how to reduce the road traffic accident and injuries in low and middle income countries.
We're able to make the information that we share with our students really relevant so that we are producing that next generation of public health professionals.
And so a lot of work is evidence for policymakers, for those engaged in developing strategies, and for practitioners themselves to reduce harm and to promote public health.